I first came to the University of East Anglia as an international relations student. I was 18 years old, just starting on my first degree, thinking that politics was going to be my career. But I always leaned towards the health side of it. We covered a lot about health policy and health organisations in the international sphere. But I completed the degree. I went away for a year. I took a year out and I went travelling, and it still felt like a little bit of a niggle in my side of like, oh, I'm really interested in health, no idea how to get into it. And then I had a very personal experience in my family where my little brother got very ill, and I sort of saw health from a clinical side and became really interested in that. So I went back to the University of East Anglia and then studied adult nursing. Then the pandemic hit in 2020 and my training suddenly took a very unconventional route after that. And I became, to be honest, a little bit less interested in the clinical side and more interested in the research modules that I was learning outside of the hospital. During my adult nursing degree, research really stuck out to me just because it fed a deeper curiosity in subjects. I think during the degree, you have lectures and you have seminars, and sometimes things are covered at a very clinical and sometimes surface level. Just enough to kind of make you a good nurse, but to really understand that these problems that we face are multifaceted and often have links and different corresponding research to one problem matches with another, and it sort of sends you down a rabbit hole of information that always appealed to me, and trying to make sense of things that are complex and make sense of things that are wrapped up in very personal circumstances and trying to understand them better just really appealed to me. So I first started working at UEA through a slightly unconventional path. I finished my adult nursing degree and knew that I really wanted to get into research, but I felt like at the time that was going a little bit against the grain of what I'd been trained for. Normally, newly qualified nurses go out into hospitals on the wards or have a clinical experience. So I emailed my personal advisor saying I really want to get into research, but I'm not really sure how to go about it. And she put me in contact with Carrie Jackson, who is extremely passionate about new researchers, and invited me to talk with her just about my experiences, what I was looking to do, which eventually led to her inviting me to be part of the evaluation team for a project she was leading on with the Cambridge and Peterborough Innovation Hub. And then that kind of just snowballed, and she introduced me to new research contacts, one of them being Anna Sweeting at the Norwich Institute of Healthy Aging, who then offered me a work experience placement. It was just going to be 1 week, but then it sort of snowballed, and I ended up turning that 1 week into 1 month and got really involved in creating an evidence briefing for her with some patient public involvement work that she was doing. And then at the back of that ended up in a 6-month internship with the Norwich Institute of Healthy Aging. So since I started at UEA, I've been working on a number of projects, one of them being part of the evaluation team assisting Carrie Jackson at the Cambridge and Peterborough Hub, where I've learned a lot about evaluation methods. I've been working with the Norwich Institute of Healthy Aging on a number of projects during my internship. The first was to create an evidence briefing for their co-production partnership, where they do a lot of patient and public involvement work with disadvantaged communities on the subject of healthy aging. So that evidence briefing was on the sort of concept of healthy aging and how that's interpreted in disadvantaged backgrounds, and how we can use that research to better involve low-income settings in the future of research. I also worked on the Charming project with Anna Sweeting and Wendy Hardman. That's another patient and public involvement project looking at multiple behaviour change in low-income settings, and I helped with data collection, evaluation, analysis and dissemination of the results as well, and I created another evidence briefing for that, which was super interesting and great to work on, and I got the opportunity to join some of the focus groups and do a little bit of that first-hand research as well, which is always exciting. I also worked on developing a CPD course for the Norwich Institute of Healthy Aging. The course is going to be on nutrition in action, a kind of very practical nutrition course looking to empower the workforce, so people who are directly working with, say, for example, food banks or nutrition provision for people in low income settings, to just give more low income sensitive nutrition advice, a kind of real world achievable guide to nutrition that's tailored to those disadvantaged settings where you might be on low budgets or you might not have all cooking facilities, so it's a lot more practical advice. Lastly, now I'm a research associate on the Splendid project. It's looking to develop a socially prescribed care pathway for people living with dementia and their carers, starting to do work on a systematic review and a realist review as part of that as well. So once again, sort of expanding my knowledge of kind of research methods and getting involved with the wider research team and having a more collaborative role in people who are a lot more experienced than me. So sometimes that can be daunting, but just learning lots every day from them and having that really shared space to learn together is great. So alongside doing the projects that I'm doing with UEA, I'm also doing a master's in public health with Arden University, which has been a great opportunity to bolster some of the practical research skills that I've been learning with UEA, with some of the theory behind it. I'm hoping to finish at the end of this year. And then I'm going on to a PhD in March 2024 with Anne-Marie on the MEDEX study in conjunction with the Norwich Institute of Healthy Aging. MEDEX is a study of the Mediterranean diet and physical activity as an intervention for people who are at risk of cognitive decline or maybe experiencing dementia already, and whether that has an impact on their cognitive abilities. So I'll be centering in on the behaviour change element of that project and looking to work with disadvantaged communities to see how we can facilitate that in the best way possible to make that happen. My time at UEA so far has really cemented my aspirations of starting out on this pathway. I think it's just cemented that this is the career for me and this is where I want to stay. It's piqued my interest in areas of health that I hadn't thought of before, like behaviour change, like social prescribing, which are quite new forms of health interventions. That has really led me to the PhD and inspired me to feel like I could do a PhD through having that practical research experience in the projects that I mentioned. Past the PhD, it feels like a very scary open world, but I think most of all, I'd like to continue working in behaviour change. And there's been this unintentional sort of concurrence of the theme of dementia research as well, running through a lot of my projects and through that PhD as well. So I think to continue doing research projects in dementia would be something I'd be looking to do. And just to expand my role within research and expand my knowledge and take on different projects that involve different methods, to become an all-rounder in research really is my goal. I don't have a specific organisation or role in mind, but just to stay curious and to keep learning, really.